Hi, FreeBody community. Kat here in Asheville, and today we're going to talk about the sternocleidomastoid muscle coming up next. Having some good tools in your toolbox for releasing the sternocleidomastoid is super important. It is so important for you to be able to work with this muscle. It's really easy to work with because it's the only muscle on the neck that you can actually grab. And I'm going to show you some ways to work with it. After this, I recorded myself working and releasing the sternocleidomastoid for an online continuing education class I did. You might consider checking out that class, getting it for yourself so that you can have the recordings, because I give a long anatomy talk, but I wanted to introduce this to you here today because so helpful, so beneficial. The sternocleidomastoid muscle goes from the sternum and the clavicle up to the mastoid process behind the ear. And what it does is turn the head to the opposite side. It also kind of pulls the head down and back depending on where the ears are landing, either forward or back of the shoulders. It gets kind of jacked. It also like lifts the head, the chin up to the opposite side, right? So a little bit of a lateral tilt, but also with a twist. So a lot of folks kind of tend to lean in, when they listen, like, oh, I'm really hearing you. That feels very different than, oh, I'm really hearing you. Just that little lean makes a difference. Now that really affects the scalenes, but also really affects sternocleidomastoid. Because its main job is rotation to the opposite side. Any of your clients who call you and go, I can't turn my head, you definitely want to work sternocleidomastoid. You're also going to check its best friend, splenius capitis, at the back of the neck. Splenius capitis rotates the head to the same side. Sternocleidomastoid rotates the head to the opposite side. So these muscles are working together front and back. Both of them attach on the mastoid process. One thing I see that folks do that I really discourage you ever to do is they try to push the head too far in rotation. So here's what I've seen over the years. I've been teaching continuing ed since 2005. I've been doing massage for 30 years, and I have seen this error so many times. Please don't ever do this, where you turn the head to one side, put one hand on there with your client on the table, push here and push the other shoulder down and back. And they're like, I've had people do it to me. I've had students in my classes do that. Someone who didn't know taught you that in massage school. It's a terrible thing to do. It's helpful to understand full range of motion of rotation of the neck is about 60 degrees. So 60 degrees is about here. It's not here. You can see my shoulder starts to come with me. So if you are forcing your client's neck to one side while pushing the opposite shoulder down, you're not helping them. You're not giving them more range of motion. You're actually maybe causing some damage in the discs, maybe causing some damage in the ligaments and causing ligament strain in the discs and around those vertebrae in the neck. You also may be causing their sternocleidomastoid, their scalenes, their splenius capitis, and what else contributes to rotation? Levator scapula contributes to rotation. Trapezius contributes to the rotation. If you're just jamming in that deep rotation and forcing them, that's not helpful. It's so not helpful. All of those muscles might go, and grip and contract strongly. Hear this. Those muscles might grip and contract strongly to protect the discs and the vertebra in the neck. So don't do that. Don't do that push, right? Instead, you can support the head. You're going to see me. I'm always supporting the head. And I've learned over the years that a lot of people hold on to their head, right? They lay on the table, they're like this. They're like, okay, I'm ready. I'm ready to relax. And they struggle to let go of the head and neck. So the more you're supporting, the more you're cradling, the more you're holding and supporting the head on the forearm, the better they will be able to let go and let you do your job well. The sternocleidomastoid is the number one cause of headaches. Numero uno, number one cause of headaches, sternocleidomastoid. I had a client recently that I was doing some telehealth with, and she's in LA. I'm here in Asheville, North Carolina. And she was like, I have this sinus infection that I've had for weeks. It won't go away. I have this pressure on my cheeks. My head is killing me. And I was like, are you sure you have a sinus infection? And she's like, well, there's nothing coming out, but the doctor says, gotta be a sinus infection. I'm just so backed up. And I said, well, try this. Actually, try releasing your sternocleidomastoid. That day, her headache got better. And within a week, her sinus infection was completely gone, right? So the sternocleidomastoid can create a sense of compression in the sinus cavities. It can make it all around the cheeks ache and inside the head ache. It can create forehead types of headaches. I'll tell another little story. When my daughter was a little girl, she's 21 now. When she was a little girl, she was laying on the couch. She was sick, like this. Her head was turned to the side, and she was like, totally sick with a fever and whatever. And then I heard her crying, and I went over to her, and she's like trying to move her head. She's like, I have such a headache. It hurts right here. I was like, oh, baby, that's sternocleidomastoid headache. And she said, don't squeeze my trigger points, Mama. She didn't want me to squeeze. I was like, no, trust me. She's like, I'm sick. That's why I have a headache. I was like, well, maybe. But maybe it's just also because you have these sternocleidomastoid trigger points. Please let me work on them. She was like, okay. So I did just a couple little spots on her sternocleidomastoids. And she was like, oh, yeah. Her headache completely gone, just like that. Now, that's like an immediate cause of a headache. She's a little kid. It goes fast. I will tell you that your clients that experience chronic headaches from sternocleidomastoid, it might take a little more time for them to have that instantaneous kind of response for that headache to go away. It's not going to be so instantaneous, but they will be helped and their headaches will go away. So releasing sternocleidomastoid, you want to be careful and mindful that you're working around the trachea. Another symptom of trigger points in the sternocleidomastoid is this clearing of the throat. I think because the sternocleidomastoid, its connective tissue, its fascial envelope or fascial bag is continuous with the connective tissue of the trachea, it can create an irritation, a sense of irritation on the trachea. So your client, I've heard this before, clients are complaining of headaches and they're clearing all the time. That part goes away. I point out that could be also from your sternocleidomastoid. Sternocleidomastoid trigger points in the deeper head of the muscle can create ringing in the ears, vertigo-like symptoms, so dizziness, ringing in the ears, ear ache, ear pressure, that whoosh, whoosh, whoosh sound in the ear. The superficial head of sternocleidomastoid, its headache is that sinus pressure wraps around the eye, forehead pain, even back of the pain head where it hurts to put your head on a pillow, little bit on the top of the head, all that can come from sternocleidomastoid. So loss of range of motion and rotation, especially headaches, sinus pressure, sinus headaches, clearing the throat, ear symptoms, earache, ringing in the ears, and dizziness. All of that from this one muscle. So beneficial to understand where this muscle is, what it does, and how to effectively release the trigger points. What are trigger points? They're focal points of tension. Trigger points are how the muscles hold tension. Trigger points are how the muscles hold tension. So if muscles are stuck in contraction, that by definition is a trigger point. I think every massage therapist needs to be fluent in releasing trigger points. You can use all your other skills and tools, but at the end of the day, releasing the trigger points is going to give extraordinary benefit to your clients. One more thing I want to say about the SCM. because it attaches on the collarbone, it's very beneficial to do some work in the pecs. You'll want to watch the video about the pectoral pull and releasing the pecs and getting ready for shoulder work. Because if a person is rounded in the shoulders and collapsing forward, because that sternocleidomastoid attaches on the collarbone, when someone rounds forward, the collarbone gets pulled down toward the belly, and that's going to pull sternocleidomastoid along with it. So you could do amazing work in the sternocleidomastoid, but if they get back up and they're still like this, that SCM is going to continue to go back into its patterns of tension and pain. So you want to open the chest. You'll want to do that belly stripping that I did. Often when people come with me to see me for headaches, I'll start in that stripping the edges of rectus abdominis. I did a video on that. We'll put the link in the description. You want to do a pectoral pull, open the chest even just a little bit. That's going to completely help that SCM start to let go, because eventually, ultimately, when a muscle is stuck in contraction and stuck in pain in a body, it's usually the end of the line, not the beginning. It's not that the tension started there. It's often that it ended there. So this headache could have started from them working at a computer all day. And it's not just from them leaning their head forward. It might actually be from this rounding and tucking, shortening the belly, shortening the chest, rounding the shoulders. And that sternocleidomastoid is like, it's kind of hanging on for dear life. So maybe do the stripping of the belly, maybe do that pecs pull a little bit, at least some warming in the pectorals to release, because the pecs attach all along the lower part of the collarbone. Sternocleidomastoid attaches on the top of the collarbone, releasing that pull of the pecs, going to help that sternocleidomastoid release. Then you can go in, do some nice soothing, get it ready. One final caution doing this work at sternocleidomastoid, you'll see me often kind of warming by wiggling it and squeezing it and doing maybe some gentle strokes upward. We don't want to do deep strokes downward on the sternocleidomastoid. The carotid artery lives deep to these heads of the sternocleidomastoid, and it's a surefire way to make someone pass out. So if you are going deep strokes downward, and that carotid artery and veins, they're all the blood supply up to the brain is going underneath this tissue, the body is they're going to pass out from doing that deep stroking down. So don't do that. Stroke up or just wiggle if you're concerned about it. Not a big deal. Light strokes, and then you can get real specific with your sternocleidomastoid work. So I hope you find this video to be helpful. Drop me a comment, ask a question. I'm here for you. I want to support you on your journey of being an awesome massage therapist. So let's see what that work looks like. So whenever I'm working in my client's neck, I always ask them to fold their hands on their chest or on the belly. And that just makes the shoulders more mobile and allows me to get in here more easily. A reminder that the jugular vein and the carotid artery are deep to our friend sternocleidomastoid here. So if you're doing any soothing and warming strokes, just keeping anything with pressure moving upward and not a deep stroke downward, because we really don't want our client to pass out on the table. That's not recommended. Okay. So our sternocleidomastoid, we're going to start with this left side. So as a way to help duck those big blood vessels deeper into the neck and softening our SCM, I'm going to slide my hand underneath, kind of lift her head, and I'm going to slide it to the left. I'm not turning her head. That's going to pull it into a stretch. I want to keep the tissue soft, so I'm going to support her head, lift it off the table, and slide it over just a little bit toward the side that I'm working on. Then I have really easy access to the SCM. Sometimes folks it's still kind of taut and difficult to get to. So you might have to support under their head a little bit more. Some folks even with a pillow. But now I can see, oh, look at that, so beautiful. This beautiful sternocleidomastoid coming from the sternum, the clavicle, and up to that mastoid process. We're going to do 2 layers deep. We're going to do the superficial head first, and then we're going to go into the deeper head. I'm just going to do some stroking. See, my strokes with pressure are moving upward. I like to do a little bit of rubbing here on the up at the mastoid process. Just kind of clear that a little bit. I might do a little stroking in the posterior neck. Our splenius capitis friend is right back there, and all those other posterior cervicals. And I want to make sure the head is not turned. Just that little lean, little lateral flexion off to the left. And then I'm going to start kind of squeezing and wiggling that sternocleidomastoid. I'm going to find the rope of that muscle. I'm going to gently squeeze it. I'm trapping it between my thumb and the edge of my pointer finger, supporting with my other fingers. Then I can give it a wiggle. Just a little wiggle, a little wiggle. Just going to bring my body around. I like to be just right behind my work at all times. So this area up at the top, closer to the jaw and below the ear, this is often a place where this muscle holds its trigger points. So super beneficial. We're going to work, this trigger points are more at the ends around this muscle. Often one right in the center and then one down at the very bottom. So Brooke, I'm going to invite you to take a nice big breath. And as you exhale, sinking your whole body down into the table, softening your head, softening your shoulders. Beautiful job. Thank you so much. And a little bit of side to side. Right up at the top, just below the ear. And I'm just kind of going a little side to side, not deep pressure. I'm just trying to do a little bit of almost like a fascial freeing here. Just wiggling the SCM inside its fascial bag and freeing it from the other connective tissues around. Right. And then I'm going to just do a gentle grab at this top portion of the SCM. Now, if you're having trouble grabbing it, it might be that you've pulled their head this way, and then it will be much more difficult to grab. So you want to make sure that the head is tilted toward the side that you're working and that their neck is relaxed. Then to do this work, you're going to grab around the rope of the sternocleidomastoid, but you want to grab the rope itself. So flat finger palpating, just trying to feel where is that rope, and then where do you slide off into skin. And you want to kind of gather up that upper portion of the muscle in between your thumb and your first finger, and feel that you're grabbing the rope itself. Often there's a little tender spot right here. How's that spot? There, Brooke. And then notice I'm, right near the jawline in the upper portion of the more sternal head, the more superficial head of the sternocleidomastoid. Now, if I don't feel I have a good grip, I'm not going to invite her to do movement, because sometimes when the client, I just felt that nice twitch. Sometimes when the client starts moving, it's going to kick you out of the muscle. So, and how's that spot feeling? Has it changed at all, Brooke? Yeah, it feels better, yeah. That twitch was a good indication. Great, beautiful job. So then I'm going to come down a little bit further along this muscle, kind of getting more toward the center in this area. Again, I want to find the rope itself, and I can use my back fingers to kind of scoop and make sure that I'm holding the rope. And when I feel that rope in my fingers, see there's the deeper head, I'm going to just give a nice squeeze. And squeezing in that rope. If I'm having trouble, I'll start to angle my thumb a little differently. So I'll come in from the top so that I can get my hand in there a little bit better. Nice, yeah. And this can be a tricky muscle to hang on to. So we're just going to hold this. And then, Brooke, could you do a little tiny shake your head no? A little faster, just like nope, 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 nope. And then a little bigger. Yeah, there you go. Great. Making sure that I'm holding into the rope itself. And you can pause and take a nice big breath. Exhaling and sinking. How's that going, Brooke? Okay? Great. You're going to let your head relax, your shoulders heavy. So easy for your clients to want to help you, and they're like, oh yeah, get that spot over there, and they might start tilting their head or engaging their neck without even being aware, and that's just really common and really normal. So notice my stroking is always upwards. Okay, so now the last point in the superficial head of the SCM is really down toward the bottom. So sometimes if you have too much oil on your hands, you might have to rub it off. I need to get into this SCM down here. So I'm going to hold. I'm going to use the other hand to kind of lift so that I can see right where that bottom portion of the sternocleidomastoid is. And I'm going to kind of grab, grab, grab. It's a little bit hard. So sometimes what I'll do is lift the head and tuck the chin. So now I actually have access. And this little trigger point here at the bottom tends to just refer right in at the sternoclavicular joint. Just tends to be nice and low, right below the attachment. It's slippery. It's a difficult place to hold on to. And so I'm just going to see if I can get down in there. So if you're having trouble, it might be helpful to stand up and get over your client. You can use one hand to support the head to keep it lifted a little bit and give you a little bit of space. Now I'm just going to demo this on the other side and trying to grab that tiny little spot right there. It's tricky, but it's worth it to get it. So the next part, we've treated down low in this SCM. We found a point in the middle. And here's the thing, your client may not have, you might not be nailing it, right? I've done this tens of thousands of times. So I can go right there and go, oh yeah, I can feel it's going to be a little bit tender there. But you may not have that, be that adept yet. That's your future. So just communicating with your person. How is that? Is it a little, do you want me to slide a little bit higher? Do you want me to be a little lower? You can just explore, but you want to be slow, flat finger, and not just grab. And you got to be really mindful and slow. Like I'm grab here, but I'm barely putting any pressure. And then I slowly sink my pressure in. And that's how you want to work. You want to be slow and mindful, no sudden moves, because there's a lot of blood supply and nerve around here. And it's the neck, it's the throat, right? A lot of protection mechanisms designed to protect the throat and the delicate structures that are beneath the sternocleidomastoid. So you just want to be mindful and slow. So that's that superficial head. Now we're going to get into the deeper one. That's the one that causes those headaches in the forehead and the back of the head and wrapping around the eye. But now we want to get into that deeper head, and that's a little bit trickier. So we're going to keep the head tilted to the side. We have to kind of scoop the tissue up from the back. Scoop the tissue up from the back with the fingers. And then this thumb, now we have to get around that superficial head. So there it is, superficial head. We want to get that thumb in between the trachea and the SCM. And we want to slide down and scoop from the back. You're going to gather tissue together. And this is the area I like to work right in the center of this muscle, halfway between its attachments. And often I have to keep a little bit more tuck in the chin to access that tissue. I might gather up a little bit more. This is the portion of the muscle that really affects the ears, ringing in the ears, tinnitus, and also dizziness and vertigo. And so I'm just grabbing the tissue that's beneath that superficial head. I'm in that deeper head. And I'm being mindful, slow with my squeezing my finger and my thumb together. And Brooke, a little shake of the head no. Is that a tender spot there? Mm-hmm. Yeah, it is, right? So shake the head no. You can choose how exciting it gets by how big that movement is. So you can play with how big or small you want that to be. And I'm just going to give her a little bit more time here to trigger point work takes time. We're patient with the body and how long it needs to trust and let go. Nice. And 5, 4, 3, 2, and 1. Great. How's that point feeling now? Better. Okay. And I'm just going to give a little stretch, a little stroke, all the way up to that top behind the ear. Great. And we're just going to check and see if there's one more spot in that deeper head. So we're going to gather that tissue from behind, drop that thumb in. Again, it works well to be right over top of your client so that you can gather that. Look, you see that beautiful sternocleidomastoid right there. I'm mindful of where my thumb is. I'm not pressing, I'm not putting pressure here in the trachea. I want to just scoop the tissue first and try to wiggle my thumb next to the trachea. I can feel a thickness of tissue there, a little firm tissue under there. I'm grabbing around the rope of the superficial head. I'm going to guess that's tender right there. Mm-hmm. Do you want less pressure here, Brooke, or is that, yeah? Do you want more pressure? No. Okay, great. And then when she feels ready, she can start doing that shaking of the head no. That's good. 5, 4, 3, 2, and 1. Ah, great. Mm-hmm. Woohoo! All right. A little bit of soothing. I find it's difficult for me to grab that sternal head or that clavicular head any lower than right in the center. And then now, Brooke, I'd love for you to do a little bit of turning your head side to side, and let's see how that feels. Mm-hmm. Remember, the SCM on the left side rotates the head to the right. And then it gets stretched when she rotates to the left. So see how great her rotation is to the left. It's nice and functional that way, but she has better rotation to the left because we released the left side and it allowed that whole area to stretch more. So now we're going to do a little bit on that right side. All right, second side, we're going to do a little work here in this right side sternocleidomastoid. And just doing our, like, here I come, sternocleidomastoid. And what are we doing when we're warming? We're communicating with the nervous system, letting it know we're coming, letting it know where we're going to be working. So there's no sudden moves here, letting the nervous system get used to this idea that I'm working around her throat. I'm not doing heavy pressure here on the throat. I'm just kind of using those edges of my pinky side, doing some stroking around there, being mindful of the vein and artery that's deep to this area. And that I'm going along the trachea when I'm down here. Like, I don't want to put deep pressure right there. She's not going to be happy with that. Her nervous system is going to freak out and she won't be able to relax and let me do this work for her. I like to come up into that mastoid process, maybe even do a little bit of rubbing in there. Nobody ever told me to stop that. That just feels really good. Where that splenius capitis comes up as well and deep to the sternocleidomastoid, and they just attach together right here. So good. Here's the point of the mastoid process, so we can just do a little drag through there. And our warming is also hydrating. It's getting some hydration, some fluids into this area. So now that we have our preliminary work done, we've gotten things ready for us to do our work. Remember, I'm going to lift the head, bring it to the side that I'm working, and then I'm going to let her relax her whole neck. Shoulder blades heavy into the table, neck heavy, head heavy into the table without pushing. And you can already see, here's her SCM right here that I'm working with. I can just scoop from the back a little bit, kind of wiggle it. I could do a little grab and wiggle. Remember, I want to grab and pull away from the throat and do a little wiggle, freeing that fascial bag that the sternocleidomastoid lives inside. Superficial head of the SCM. And I'm going to start my work up higher, very commonplace for it to be very tender. So I'm gentle. I'm not pinching my fingers too hard. I am pinching this muscle, but I want to be mindful of how much pressure. I'm just kind of feeling the quality of the tissue and the thickness of that tissue. And then I'm going to do a little grab, gather it from the front and the back between my thumb and my forefinger. And then remember, I want to grab the rope itself so I can feel where I'm just about to slide off, grab a little bit of that tissue, and then squeeze the rope itself. How about right there, Brooke? Is there a tender spot there?
Mm-hmm.
Okay. And do you want more or less pressure?
Maybe just up a little bit towards the ear.
Up a little bit toward the ear. Great. I love that guidance. When we get closer to the ear, sometimes we have to tilt the head even a little bit more to be able to really pin that tissue.
Oh, yeah, that's it.
That's going to be it right there, yeah. Mm-hmm. Do I have it again?
Yeah, that's perfect pressure.
Okay, and no movement because I'm going to slide off if you start moving. So we're just here, whole body relaxing into the table. I'm going to take some deep breaths also. Really letting your thighs be heavy into the table. Make sure your glutes are soft and relaxed. And just let me know when that feels a little bit better, a little bit freer.
Mm-hmm.
Great. Mm-hmm. So I got the sign, so it's a little bit better, a little bit freer. I'm just going to do a little soothing on there. I could explore a little bit more around that point. We're going to go right to that center area. Center area, I'm going to support her head. I'm going to gather that. Remember, we're working the superficial head, so we're not doing a deep sort of dig with the thumb yet. I want to hold that rope. I want to make sure that rope is between my thumb and my finger. And I'm just going to do a little squeeze. Is there any tenderness right there, Brooke? Okay. And I'm going to ask you to keep your breath really low in the belly. If she breathes up high in her chest, that's going to engage that sternocleidomastoid and make it harder for me to hold on to. So we're going to keep her breath low in the belly. Beautiful job. Beautiful adjustment for me. Thank you. And I feel like I have a good hold on this one. Would you like to shake your head no, please? Doesn't have to be real big. Woohoo! Okay. And it is making it harder for me to hold because I can feel that deeper head is also holding tension. So I'm going to ask her to stop the movement. I'm going to drop her chin a little bit more. And I just want to show that, like, really holding and supporting the head and holding up and supporting the back of her head real nicely. This tucks the chin a little. It's going to soften that area. Then I'm really holding and supporting her as I tilt her off to the side. And then I can perhaps have a little bit of an easier grab on that SCM. I can feel that, yeah. And I think that's that deeper, yeah, that's the deeper head. So we're going to go superficial head. Ooh, there's so much stuff going on in there. It just feels thick and a little bit kind of sticky together. And Brooke, you can always tell me if you want more or less pressure. Feeling that ropes of that muscle. This side feels ropier, thicker a little bit than the other side, so I'm guessing a little more tender than the other side was. So I'm even more mindful. And we can continue our exploration. I might be able to get a little lower. Be mindful that the trachea is right there. A lot of tenderness on this side. Okay, and I'm going to just let go of that. Doing some soothing, doing some soothing, doing some soothing, soothing up the back. Remember that splenius capitis? Also pulling on the mastoid process. Do a little, just a little nod to those pecs. That might be what's actively pulling on that sternocleidomastoid in the first place. Great. So now we're getting ready to do a little, give a little attention to the deeper head of that SCM. So I'm just going to release her head for a moment. We're going to talk about that again, that deeper head of the SCM. I've got to get my thumb right next to that trachea. So I have to come a little bit more from the very top, and I'm about halfway between the attachment ends. So I'm kind of right in the center of the neck. And I kind of start by anchoring that thumb right next to it and kind of sinking it very gently and mindfully because I'm right next to the trachea. I'm just going to keep saying that because there's all those protective mechanisms. Once I get my thumb down in there, I can scoop that other tissue from behind and get that deeper head right there. How about that, Brooke? Tender.
Oh, yeah.
Oh, so icky. Mm-hmm. And there's a lot of tension in here, so I'm just going to ask her to not do any movement right now. But Brooke, I want you to picture shaking your head side to side. Just imagine that you're turning your head from side to side. I know that sounds a little crazy, but it actually works sometimes, quite often actually. So back to that deeper head. Bringing the hand from above, sliding that in next to the trachea, being mindful that there's little threads of nerve and all kinds of stuff going on in there. So just slow. If you give the viscera time, it will move out of the way a little bit. And then we're pulling those, gathering those posterior fibers, are kind of stripping along here. It just makes it easier for us to get that deeper head of the SCM. And just a little squeeze. Breathing in your belly, Brooke, keeping that breath low in the belly. Yeah, great. Great. And then just some stroking and some love, remembering to go always upward when you're in this area. A little down on the sides because our scalenes might be a little jacked up from all of that. Stroking up the posterior cervicals, a little bit of our friend splenius capitis, which you're going to want to give some attention to after you do some work in the sternocleidomastoid. And then I'm going to ask my friend Brooke to turn her head right and left and see how that range of motion is now. Good to the left. Let's see if we got any improvement to the right. Oh yeah, so much bigger, so much better. How's that feel? Does it feel a little freer?
Mm-hmm.
Great. One more time to the right. Beautiful. And back to center. Great. And that's treating sternocleidomastoid.